koutou, ko Trish Higginson, tuku wingua, he kaimahi aho I whānau Whina Plunkett. And today we're here to talk about measles and how you can make sure your pipi are protected. So I've got the wonderful Andrea here, and she's going to introduce herself now. Kia ora, Andrea.
Kia ora, Trish. Tēnā koutou katoa, ko Andrea te and tōku ingoa, no Wairarapa aho. I'm a nurse and I work for IMAC as a education facilitator and clinical advisor. Kia ora, Trish. Thank you for having me.
Wonderful to have you here today, Andrea. So today we're going to be having a kōrero about why measles is up on our radar again and how we can prevent a measles outbreak in our community, and the best way to keep our whānau and pipi protected. So with all that being said, Andrea, can you explain to the whānau watching today why measles is out there on the radar again?
Yeah, absolutely. So, you know, it's a real concern. Measles is a horrible, horrible disease, and we know that the best way to prevent this vaccine preventable disease is through immunisation. That is the best protection. We know that with 99%, after a vaccine, you're given 99% coverage from the measles disease. And of course, this also, by being vaccinated, helps to support the community to be protected under something called herd immunity. We know that measles is on the increase internationally, and that in particular our whānau who are particularly vulnerable are our pepe who aren't vaccinated yet, and also those who are immune compromised. So yeah.
Yep. Perfect. And that 99% protection, Andrea, that is after having a course of MMR vaccine, which is 2 doses. Is that right?
That's correct. 2 doses, yes. And currently on our schedule here in Aotearoa, those vaccines are given at the 12-month event and 15-month event.
Wonderful. So how can we best prevent measles, Andrea? What sort of things can whānau do? You mentioned that little pepe are unprotected until they can receive that first vaccine at 12 months. So that makes it all the more important for whānau around pepe to be protected and vaccinated as well. So could you explain a little bit about how we can achieve that optimal protection for pepe?
Absolutely. So the best way to get protection is to be immunised. Now, you can go to your GP, your general practice. Your practice nurse can give those vaccinations to your pepe and whānau. And of course, some pharmacies are also offering that service now as well. If you're unsure if it's available in your area, do contact your GP. And if you don't have a GP, you can actually use a website called HealthPoint to find out where you can go and get that vaccine.
Brilliant. We can put that down in the chat if whānau want to access that. So what about travelling? Because we know that measles can be brought in from internationally from people travelling on aeroplanes with who've potentially been infected. So how can whānau protect against that? What's important to know there?
Yeah, so if anyone is travelling with children, they need to check their measles status. So you could contact your GP just to make sure that your tamariki are up to date. And like I said, normally they would have their vaccines from 12 months and of course their second dose at 15 months. Yeah. And of course, we need to also remember that there can be some maternal antibody transfer from mum to pepe when baby is born. So that does also give that early protection before that baby is vaccinated. But absolutely, if you're considering travel, please get your vaccines on board if you can prior to leaving. If you're unsure, talk with your health professional.
Yeah. And so if anyone is travelling overseas, pepe can actually get an early vaccine from 6 months of age. Is that right, Andrea?
That's correct. Yes, we do encourage you to have those conversations with a trusted healthcare provider just to make sure that everything's covered as well as your national schedule, as well as the other vaccinations. So not just MMR, but everything that's available to that baby as well, particularly if you're traveling.
Wonderful. Yeah. So if people were going to get the 6-month vaccine for traveling, perhaps if they're going overseas, they would still then need their 2 doses at 12 months and 15 months. Is that right, Andrea?
That's correct. For long-term protection, we would absolutely suggest that you have that second and third dose. So that first dose is given just to protect Pepe in those sort of first vulnerable few months before they turn 1, if they're traveling. So that can be available after a discussion. Yeah.
Great. And we also know that breastfeeding boosts babies' immunity. You talked about the maternal antibody transfer at delivery, and breast milk also passes antibodies to baby as well. So how can whānau check whether they're covered, Andrea? What would they need to do to find out? And I'm thinking particularly for people born sort of around the 70s and 80s who may not know their vaccine history. What would they need to do to make sure they're protected?
So the first thing I would do is contact the GP, and they can certainly find that out. Of course, if you're born after 1969, we do recommend that you have 2 documented doses of MMR. As you mentioned, there may be some that may have only received 1 dose at the time of the schedule. And of course, you are entitled to that second dose as a catch-up. So contact your healthcare professional, talk to your tamariki ora nurse, your well child nurse, your plunket nurse, if you're unsure how to get that information. If you have your well child book, your plunket book, have a look in there, see if it's documented. If it is, please make sure that your medical centre has that information. But yeah, we certainly support vaccinating those that don't have 2 documented doses of MMR vaccine.
Great. So if you're not sure, if you were born after 1969 and you're not sure you've had 2 doses, it's okay to get another dose just to make sure.
That's right. 2 doses.
Wonderful. Great.
Yeah.
And so, Andrea, what about people who might be hesitant about having the vaccine? What advice would you offer to them?
Yeah, so once again, talk to a trusted health professional. It is a case by case. People they're hesitant for all sorts of reasons. And I think it's a great idea to have those open, honest discussions, talk with the whānau, see what they're concerned about. There's some myths floating about there. And I think it's always good to make sure that you've got the correct advice so that you're making the correct choice for your whānau.
Wonderful. That's fantastic. And there's also some really good resources that whānau can access online if they do want to have a kōrero around that. For example, they could ring Healthline to talk about it. And there's also some website information as well, which we can share in the comments section there. Also, while we're here, we need to remind whānau that this year's flu vaccines are available and you can get them through the pharmacy as well as the GP. So, it's getting to that time of year, isn't it? The weather's getting a bit colder and Have you got any information about the flu vaccine this year, Andrea?
So I would recommend those who are wanting information to have a look at the flu kit. That's a fantastic resource that can be downloaded from the IMAC website as well as Te Whatuora. And it certainly outlines all the vaccines that are available to the public this year. And out of the 5 vaccines, 1 is the funded vaccine this year. So it can be a little bit confusing with all the different names floating around. So if you are considering a flu vaccine, if you're unsure if you're eligible or not, once again, please contact a trusted health professional, have a discussion with them. They will certainly, give you the right information so that you can make that choice around which flu vaccine to have this year.
Great. And what about the COVID vaccine? They can have that alongside the flu vaccine as well? Because I know there's quite a lot of COVID out there at the moment. Do you have any information around the current available vaccine for COVID, Andrea?
Yeah, so once again, on the IMAC website, we have, of course, you don't have to be a health professional. Members of the public can access that website. There's lots
Right.
of really good fact sheets and information, which, is written in a way that, it's easily digestible. Once again, there's a couple of different types of COVID vaccines. Depending on the age that you are, will certainly depend on the type of vaccine that you will be offered. And of course, we know that hapu mama are also encouraged to have their flu vaccine, and of course their Boostrix vaccine. So check out our website, lots of really good resources there.
Great.
And yeah, I would suggest that, yeah.
That's wonderful, and I'm so pleased that you brought up about hapu mama, because we know that they have a much higher susceptibility to complications from flu, and also so important that they get that on board. We do have a couple of questions, a couple of partai here in the chat. So someone is asking, what advice would you offer, Andrea, someone who doesn't have a GP? And this is a common question we get on Plunket Line. Mama wanting or whānau wanting to vaccinate their pepe, but they can't get into a GP. So what are their options?
Yeah, I would, once again, yes, contact Healthline or Plunket Line, or talk to your well child tamariki or Plunket nurse as well. But certainly, immunisations on the national schedule are free if you're under 18. So, certainly, they will find a way to vaccinate bubs.
Right.
Even if it's in a casual capacity in some areas. So depending on your area, contact a health professional or the well child nurse.
Yep. Wonderful. We have another partai here. Can mama get the MMR if they're hapu, Andrea?
So the MMR vaccine is actually what we call a live vaccine. So it's actually contraindicated, which means it's not recommended to give an MMR vaccine to hapu mama. So if a pregnant person, say, only has one documented dose of MMR vaccine and is already hapu, then the recommendation would be to wait until baby is born before that person is given the second dose of MMR.
Great, excellent.
Yeah.
And so just to reiterate, in case we have any hapu mama out there listening, what are the recommended and funded vaccines for pregnancy in Aotearoa?
Yes, yeah. So we've got the flu vaccine. So with the influenza vaccine, that can be given at any stage during your pregnancy. We also have the COVID-19 vaccine. That again can be given at any stage during your pregnancy. And the third vaccine that is recommended and funded for hapu mama is something called Boostrix. Now, Boostrix helps to protect against 3 diseases: tetanus, diphtheria, and pertussis, which is commonly known as whooping cough. Great. That is recommended and funded from 16 weeks. Of course, is recommended to be given at every pregnancy.
Yes. Yeah. So if you have a baby and then 2 years later, if you're lucky enough to have another pepe, you need to get that Boostrix. And the reason for that is because the antibodies are for the baby. Is that right?
That's correct. It gives baby a little bit of protection against that pertussis infection. So once baby is born, if mum has had that Boostrix vaccine while she was hapu, baby actually benefits from some immunity. It's called passive immunity, and
Wonderful.
Is protected until baby receives his or her 6-week immunisations.
Okay. So once baby has had the 6 weeks, 3 months and 5 month primary dose, they're covered for whooping cough then. That's wonderful how it ties in with the maternal antibodies. I've got another partai here for you, Andrea. One whānau is asking, is baby free for flu vaccine as well? checked online, some say free and the GP charge $30. I'm not sure how old the pepe is that this whānau is referring to. So what are the funding criteria around flu vaccine for pepe?
Yeah, so a great thing to do is to once again talk to your health professional. It does depend on age. Of course, flu vaccines are not given to pepe under the age of 6 months.
No.
So from 6 months and onwards, baby can receive flu vaccines. And so, yeah, talk with your health professional. And of course, the flu kit also has that information, which I can also elaborate and look at that eligibility.
Right.
And
So
just come back
Andrea,
to that in a moment.
wonderful. Awesome. Andrea is just such a great source of information. And for those whānau watching who aren't aware, IMAC stands for Immune Advisory Centre, and that is such a wonderful organisation, and their resources on their website are fantastic. They run a lot of training for vaccinators and just generally fantastic information and lots of research going on there as well. So immunisation schedules change all the time, and that is something that whānau might be aware of, but it's so important because it's all tied in with epidemiology, which is our disease statistics in Aotearoa, and also when is the best timing for that vaccine as it ties in as babies develop and grow. It's very important that they have their vaccines on time, and the reason for that is because that's when the antibody uptake is best. For example, 6 weeks, 3 months, 5-month vaccines are all given at that time because that's when they get the best uptake of antibodies. Is that right, Andrea?
Yeah, absolutely. So thanks for that. I will just go back to that other question. So it's actually people who are aged 6 months to under 65 with eligible conditions. So they're able to take advantage of a free flu vaccine. So if you think your baby might be eligible or you're unsure, please contact a health professional. And also to make note as well, this year, children 4 years of age and under who have been hospitalised with a respiratory illness or have a history of significant respiratory illness are funded for an influenza vaccine this year. And of course, that makes sense, doesn't it? Because they're more vulnerable, particularly if they have, sort of a condition which affects their lungs and breathing.
Yeah. I've got another partai here. So why does age matter for vaccination status? I think that this whānau member is referring to the difference depending on when you're born. For example, after 1969, or for those born prior to 1969, what's the difference there, Andrea?
Yeah, so prior to 1969, that's actually before they had the vaccine. That's before it was available. So before 1969, unfortunately, people just, contracted measles. Now we know that even with healthy people, measles can have, significant health impact on people, and of course, as we know, can cause death. So after when the vaccine became available in 1969, we were able to then offer vaccinations. So then people were less likely to contract measles. It's a great way to sort of offer that protection without having to suffer the disease. So depending on your age, once again, if you're unsure, am I eligible? Do I need a vaccine? Don't I need a vaccine? Just speak to a health professional. They will be able to explain that to you.
Great. Wonderful. Yeah. I just thought of going back to the hapu mama vaccines with the whooping cough vaccine. Is it also important for whānau who are going to be around the new pepe to be covered for that as well, Andrea?
Yes, absolutely. So there are some funded whooping cough vaccines available to whānau, extended whānau, and once again, talk to your health professional, but that's generally at the 45 and 65 event. So it would be a great idea if you haven't had a pertussis-containing vaccine, say in the last 5 to 10 years, then we would strongly recommend that you go and look for that, and you'll either be eligible, you may have to pay for it, but of course it's about protecting that vulnerable pepe, and I know most people would be more than happy to do that. So yeah, that would be a great idea.
Yeah, no, it's all about protecting those precious little pepe, isn't it? Because I know that whooping cough often is highly contagious, and outbreaks come out sort of cyclically every sort of 5 to 10 years or so. And they are usually passed on within the whānau. So if we can get whānau who are going to be around pepe protected and get their Boostrix vaccine, that's wonderful. So if there are any more questions, if anyone watching has any more pātai for us, otherwise we can look at wrapping up. Have you got anything more you want to add, Andrea?
Really just to say that, as well, I know we are talking about measles today, but just really encourage whānau out there watching today to make sure that your pepe, your rangatahi, your kuia and karaua, the kaumātua are up to date with their immunisations. A lot of these vaccine preventable diseases do require boosting. So please support each other to go and find, get the information and support each other to go and get vaccinated. It really is one of the best ways that we can help to prevent some of these, really horrible diseases.
Absolutely, and prevention is much better. No one likes to see little pepe sick or, feel that we're going to compromise them when we don't have to, when we can protect ourselves and whānau. So I think that's it for us today. Thank you for watching, whānau, and thank you to Andrea for your expertise and for joining us today for this kōrero. And everyone, stay safe out there. Remember, winter's coming. Get those flu vaccines. Thank you, Andrea. Ngā mihi, kia pai tora. Have a lovely day. Have you got anything more you want to add, Andrea?
Kia ora. No, thank you, Trish. Thank you. Ngā mihi nui koutou, and stay well, whānau. Kia ora. Thank you.
Ngā mihi.